ACR Bulletin Podcast, the show where we cover the latest trends affecting radiology. I'm your host, Chris Hobson, and today we'll be talking with Dominick Parris. Dominick serves as Senior Analyst with ACR's Strategy Management Team. Dominick, it's great speaking with you today.
It's great to be here. Thanks, Chris.
Absolutely. We're just so delighted you can join us. Well, today we'll be discussing the 2021 ACR RBMA Workforce Survey. So Dominick, could you please give us some background as to what this Workforce Survey is and has been, and also how the survey results are used?
Yeah, so since 2012, the ACR has deployed a survey of practice leaders in radiology to really drive down on the vital stats of the radiology workforce, where radiologists were needed, how many were retiring, demographic information, questions about FMLA leave, that sort of thing. And so that's where it was, and it was one of the more cited papers in the JCR for many years. But when the COVID pandemic hit in 2020, the commission and commission leadership, Eric Rubin, the HR commission, I should say, decided to take a pause in order to be sensitive to folks who might not have time to take what had become a fairly long and onerous survey. Because it was a fairly detailed questionnaire. And so we took that opportunity to rethink it. It had in many ways been suffering from being overlong and perhaps having more topics in it than a single survey should cover. Survey fatigue was a thing, and our members see no shortage of surveys. So we took the opportunity and we shortened it for individual survey takers, but we actually expanded the scope. Initially, the survey, like I said, was of practice leaders. Well, we took the opportunity to look at rank and file radiologists as well, using a tiered qualification structure. So if you could answer questions about practice level decision making, hiring, that sort of thing, you received those questions. But we expanded the total population to include practice leaders, retirees, and rank and file radiologists. We teamed up with RBMA to expand our pool of practice leaders, and then we used the ACR sample to get a little bit closer to understanding what was interesting and what was noteworthy from the rank and file perspective. So we ended up with a fairly significant response and some fairly interesting data.
Yeah, that we're going to dig into today, I hope. So, well, I know that from talking to you before we sat down today, one major finding from the most recent survey is that we're seeing a shift in the demography of the radiologist workforce, which you kind of alluded to there a little bit. Can you please tell us, I guess, expand a little bit more on these changes and what they may portend for the future of the profession?
Well, similar to what we're seeing and then we're going to end up talking about other research we do. That's really what our shop does. But similar to what we're seeing with med students, where you see a 50-50 split of males and females in that cohort, we're seeing an upward trend in the proportion of radiologists who are female or persons of color across the workforce, and primarily in the younger folks. And so we're shifting. Radiology has traditionally been an older white male club. The average radiologist is a 51-year-old white male in private practice. That's changing.
Yeah. And I guess, as you say, with the average radiologist likely to be younger and more ethnically diverse, I don't see that trend slowing down anytime soon. Do you anticipate that broadly their preferences will track against the average younger worker across all professions? And I know that's a lot to ask, but I guess, for example, specifically to radiology, do you foresee the average radiologist placing more emphasis on things like work-life balance, which you see a lot across different professions, environmental stability, especially as you get younger in the demographic of young professionals, and also things like proactive healthcare, which I know is making waves right now?
Sure. Yeah, I think a lot of this, what's interesting to me is trying to separate what happened during COVID from other workforce trends. You know, in order to say that that young folks have entirely different values, you have to be able to separate it from history, and we can't really do that. But what we can say is that people worked really hard during COVID, and so a lot of the options were telework, right? So the environment created a situation where work-life balance became a focus. So yes, I would say that younger radiologists are probably going to be more interested in telework. They're probably going to make themselves more available to employed models of radiology, and their values are necessarily going to be different. And how that plays out in the long term, and the implications that has for healthcare are, you mentioned the idea of value-based care and really patient-centric care, and we do see that more. Again, younger and more diverse. So it's not just younger, but it's a diversity of opinion is going to be changing the way radiology moves.
Yeah, and I've mentioned this in other previous podcasts, but like in the Imaging 3.0 world, for any viewers who know what that is, that's just an initiative that's going on for like 10 years now to really highlight innovations going on in radiology. And the original idea of it was to try to inspire with these very human stories of radiologists who are coming out of the dark reading room and interacting more directly, whether it's with, a coordinated care with referring physicians or other doctors or even patients. And so when COVID hit, that threw that for a big loop because so many radiologists ended up starting to work from home, and we were getting back into the teleradiology world again with a new spin, which I guess is now now everyone kind of expects everyone to be available online. And it's just, I'm just throwing that out there for viewers who might be interested in more on this topic. I talked to, for instance, Dr. Thorworth about this and some other people in prior, but I didn't know do you think you still, if I'm not putting words in your mouth, you see things are still a little bit unsettled. We're just kind of waiting. People say we're coming out of the pandemic, but who knows? But so do you think it's kind of a wait and see moment right now more than anything? Yeah.
I think the best research drives more questions than it has answers in some cases.
Right.
And I mean, there were a number of words you just said where we talk daily in our shop about the nuances. When you talk about teleradiology, are you talking about somebody working from home or somebody who is an avowed teleradiologist? Are you talking about, somebody who works because a teleradiologist could be going to a facility in order to offer, CMS required coverage for a building, but they're getting their images shipped in from another facility.
Yeah.
Meanwhile, a person working from home is different. So if we're doing research on those cohorts, we have to look a little bit more closely at it. And then all of this. So one of the things we found was that the primary practice type is still private practice. The majority of our radiologists consider themselves private practice radiologists, and the majority of the practice types that we see are private practice radiology. But what does that mean? If you talk to 5 different private practice radiologists, you're really probably looking at 5 different practice models with 5 different sets of resource requirements and pressures. Whereas there may be more similarity in other practice types. So that's actually something we're going to be digging more deeply into, putting together some groups of physicians to really talk about what practice type looks for them, what looks like for them, what teleradiology looks like for them, what overnight coverage means.
Yeah, I was thinking Nighthawk. Yeah.
Well, I mean, one of the things that you really have to think about is anybody who is becoming a radiologist in the past couple of years saw volumes go through the roof, right?
Yes.
They were experiencing what folks call the radiologist shortage, and while I hope I'm not jumping too far ahead, but we did not see any evidence of a great resignation, but we did see evidence of movement among the different practice types and folks really trying to tailor their career to get closer to what they want.
In some ways, that's this is a whole separate conversation, but it would be interesting to parse the numbers along the lines of geography at some point, because before the pandemic, I know there was such a hard time, not hard time, I don't want to say that, because there are obviously leading lights who are doing this, but on average, it was maybe a little more of a challenge to induce a lot of radiologists coming out of school or out of fellowship or whatever to go to like the the smaller cities, or maybe, middle of nowhere, where their skills really could make a much bigger impact. But it'll be interesting. I'm sure that's something guys are gonna dig into, or maybe you already have. But
a little bit. So one of the interesting things we asked folks how likely they were to look for new work in the next year, and it turns out most radiologists are not moving. Yeah, so the ones that do want to move to a number of different practice types, but from whatever practice type you're in right now, there was a contingent who wanted to be in private practice. So if you're in the hospital setting, there were some who wanted to move to private practice.
Sure.
Actually, private practice, when you ask private practice radiologists which practice type they prefer to work in, next year, the most likely answer was private practice. So private practice is in demand, but what about private practice, right?
Right.
You see private practice as the smaller practice types, right? There are fewer radiologists in a private practice on average than there are in an academic practice. And we did look actually at geography. Generally, when you look at most of the academic practices you find in the Northeast. And then national and private practices kind of in the South by numbers. And then, so that sort of thing. But we're still in flux, I would say. I don't think this has settled out yet. And gotcha. I think that a lot of, again, the radiologist shortage, I'm not sure. We haven't done much research on that shortage exactly. We don't have those numbers. Gotcha. But there is, I haven't talked to a single radiologist who does not perceive one, or at least difficulty hiring right now.
Yeah, and I know that's a broader issue in medicine in general. Is just as this aging population that's so big, the baby boomer population ages, that obviously there's going to be shortfalls here and there. So, after talking to you a little bit in preparation for today's talk, I know you all didn't specifically ask about this in the survey itself, but I'm wondering, based on the data you did receive and maybe just your own insights, I wonder if you can extrapolate whether radiologists think tools like artificial intelligence, like proactive imaging, like these ideas you hear talked about, do you think that they'll play a significant role in the future of radiology, maybe in the next 10 years, say, and particularly when it comes to keeping pace with that increasing workload?
Absolutely. I do think it will matter. I wouldn't want to speak to what radiologists think about AI. We're actually working on that survey with the Data Science Institute right now.
Oh, interesting.
We will have some data on that in the future.
You'll have to come back and brief us on that.
Yeah, bring somebody from DSI with me so that they can speak more intelligently. But I'll tell you this. So I would say that the impact of AI is going to be manifold in that it's one of the things, technology is one of the things that likely drives interest in radiology. Right. The doctors who have a unique interest in that technological aspect of things. But again, this actually hinges on practice type. In anecdotally, speaking to radiologists, you're not going to see a lot of AI being used in small private practices, right? Where are you going to see the cutting edge technology being used? Larger national practices and academic practices, right? So what you might see is a lesser resourced practice, not using these, not incorporating AI as frequently. There are difficulties in that. And there are many AI out there. What I'm guessing happens is that those smaller private practices will first, before installing clinical AI to make themselves more efficient, they will be adding non-clinical AI to make their practices more efficient, maybe more cost efficient. And that's where I see that starting. And there are a number of AI out there used for scheduling and that sort of thing, non-interpretive functions. And that's where I really see the first impact being. But then once you get to some level of ubiquity, once the average radiologist is using that AI, I do believe it's going to create incredible efficiencies.
Yeah, and that's like when I mentioned proactive imaging earlier. I mean, one aspect of that that's been made a lot of in recent years is incidental findings management, and that's really very challenging to take ownership of that if you don't have that, either some sort of artificial intelligence that helps route patients in different ways, or nurse navigators or something like that. So that'll be really, I think, an interesting one to watch too, apart from scheduling and things like you mentioned. So I guess, what I'm really interested in is, I guess an outgrowth of these human resources shortfalls when it comes to staffing, whether it's radiologists or, other staff members who really keep the trains running in these practices. So I think an outgrowth of that is accessibility issues for the patient. If there's just not enough, if there's not enough people to cover the work, that presents, you said, population health management. I mean, a central tenet of that is accessibility across the board. So, when we look at resource gaps that our younger radiologists particularly will have to deal with coming up, and maybe in a world in that transitionary period where AI might not be able to stop all the gaps. So, how do you see this playing out, at least in the short term? Again, this all needs to be settled out, but at least in this next 5-10 years, do you also see this looming issue of accessibility for patients? And if so, how do you see future radiologists contending with that?
I don't know if I see a giant future issue with accessibility because of the technology that's allowing us to have this interview.
Interesting.
I think that these cell phones are ubiquitous. We all have a screen that we have access to, and most doctors' office. I don't know anybody who during the pandemic didn't have a telehealth visit.
Right.
So I would argue that young radiologists are going to be challenged to create efficiencies unforeseen in previous generations.
Right.
But I would also argue, I mean, when you think about, the housing market and how it responded to all of a sudden everybody being able to work anywhere. When you think about what we call the Great Resignation, which, I think was more not a resignation, but a shifting, right? People were all of a sudden mobile because of technology like this. Technology that allows us to talk to each other from across the country, I think is going to create a new kind of accessibility. Before you could have a telehealth visit, everybody had this ubiquitous technology, but it didn't do anything for them. So perhaps the answer is already in our homes, on our laptops, on our iPads, on our, and it's just figuring out how to leverage these things, how to capture that in electronic health records, how to share it with, referring physicians and the like, how to essentially streamline what has been these fragmented tools to becoming a more universal patient care. And I see opportunity. I see that all the time. But I think it's going to be, I think we're going to see more efficient radiologists who also are more accessible.
Interesting. Yeah, I think where before the pandemic, a lot of radiologists saw, or at least a lot of the forward-thinking radiologists saw technology as maybe, kind of, I guess, it was the kind of thing where you commoditizing, like you could have people reading from other countries and maybe not delivering that same level of quality. And so we worried there was a race to the bottom because of that. But now I think, maybe mid or post pandemic, we are seeing that as almost a positive. It's interesting how it's completely turned around. So just to echo what you're saying, I completely agree with you. So I guess to round things out, how are you all planning to share the data you've gathered from particularly this survey, since it sounds so robust? And I guess, is there a convenient place where ACR members can find this information at some point, or will it be published in the scientific literature?
So what we're going to be doing is the HR Commission, the ACR Human Resources Commission, is working on a number of different papers. I know there's one coming out about FMLA. There's one coming out about the diversity aspects of this paper. We even wrote one about the methodology alone that I was working on this morning.
Oh, wow.
And then we will be partnering with our friends over at RBMA, and hopefully there'll be webinars and that sort of thing. But really, in the long term, this is a baseline for future research. In a couple of years, we'll be able to trend this against itself, and really we look forward to having these conversations. So if anybody ever wants to have a conversation about this stuff, survey@acr.org is our email address, and we're always happy to talk. And I also want to add, if you're interested in getting involved in research, we put together focus groups. We're sending out surveys frequently, and we don't want to overtouch the folks who don't want to be surveyed or don't want to get involved in research. But I have a feeling there are a lot more radiologists who do than don't.
Gotcha. So can you just repeat that email address one more time where people can reach out to the team?
Yeah, it's survey@acr.org.
Okay.
SURVEY.
Awesome. And I guess if anyone has any questions about that, is that the best place to, or do you want to, are you comfortable with people reaching out to you, or is that the best email?
That's the best email.
Okay.
It's a catch-all, because if you send it to my email, I get too many emails.
Gotcha.
So
okay.
It's
excellent.
We check and respond officially to that other one in my email box.
Good. Yeah. Excellent. Well, thank you so much, Dominick. That was such a comprehensive view of that. And I really appreciate you joining us today. And for our listeners, if you have any ideas for future show topics, please let us know on Twitter at the handle @RadiologyACR. And please include #ACR Bulletin Podcast in your tweet. I also invite our audience to check out all our past episodes at Apple Podcasts, Spotify, Google Podcasts, and be sure to subscribe to ACR's YouTube channel to stay up to date on all of our latest episodes. And finally, please do hit that like button on this video if you found it valuable. Thanks again, Dominick. Like I said earlier, I really hope you can come back and on a yearly basis, or maybe even more frequently, and update us on this, because I think everyone will be interested to know more.
Anytime, Chris. I love these conversations we have. And, Chris and I, for everybody else's information, Chris and I have worked together for a long time on patient and family-centered care issues and things like this. So yeah, anytime, Chris.
Absolutely. This is fun. All right. Well, thank you so much. And thanks to everybody else. See you next time.